Good morning. I am here with Commissioner Adrian Garcia, Precinct 2 Commissioner, as well as Roy Armstrong, who is Walgreens Regional
HOU Newsroom. We're breaking in to take you over to the Harris County Judge, Lena Hidalgo, talking about some expanded testing in Harris County. The county partnering with Walgreens to get some more tests out there. Let's listen in live here from the TransStar building. Harris County Judge Lena Hidalgo.
We are well beyond 4,000 cases of Houston and Harris County. We are well already 4,000 cases, 50 deaths, and we have had already at least 50 deaths, and we're waiting here for the latest case count update for Harris County. If we're able to receive it on time, I'll share it with you guys, the one today. The people that are dying each day, most of them have been seniors, many of them grandmothers, grandfathers who will no longer be at the Thanksgiving table this year. The stakes are high, and those are the stakes. They're life and death. And because of everything you all are doing, we're faring better than other communities. Folks are watching Houston and Harris County with concern, with additional attention because of our size, because of our population, and with everybody's efforts, we so far are faring better. But we're not out of the woods. We're not out of the woods, not by a long shot. The case count continues to go up. Of course, the admission rates continue to go up at hospitals, particularly at our public hospitals. We are very close to capacity, and that's really what we're watching, is those continuous increases. We still haven't seen a tapering off or a peak. So we need to continue to, with our efforts until we get there. I know folks are hurting. I know that this is painful, and it's painful emotionally, it's painful economically. And know that I am committed to getting us back to normal life as soon as possible. But the path to getting our economy back to normal life requires a couple of steps. The way to do that is twofold. First, we have to reach our peak. We have to make sure that we've reached the peak of new cases, and then we're tapering down. Number two, we need mass testing, universal, rapid testing, so everybody knows who's healthy and who's not. That's the only way we get back to work. It's the key to getting our economy back and running again. From the beginning, we've said that without adequate testing capacity, fighting COVID-19 is like shooting in the dark. And a cornerstone of our strategy is having that rapid testing, that accessible testing. Every step in that direction is big news. And that's why today I'm proud to announce this partnership with Walgreens. Over the past week, we've been working closely with Governor Abbott. We've been working with Walgreens President Richard Ashworth to expand testing capacity across our county. Walgreens has testing only in a handful of states, and the representative here will go into more detail. But, you know, Illinois, Louisiana, Arizona, Michigan, and now Texas, right here in Harris County. The only 2 sites in Texas are now in Harris County. They will be here starting on Friday. So today we're proud to announce 2 additional drive-through testing sites. One will be in the city of Houston and another in the city of Pasadena. And I've been in touch with Mayor Turner and Mayor Wagner about this as well. So this is how it works. Beginning on Friday, 2 Walgreens locations will begin offering drive-through testing for up to 200 people per day. They'll be open 9 to 5, 7 days a week, and Walgreens has provided dedicated space for this to happen safely. Now, they will function in many ways like the testing sites we already have at the county. Folks will have to go through an online screening tool because even though this is a step forward, we still have more demand than we have supply. And so folks will have to go online in advance. Walgreens has their link but you can also access their link through readyharris.org, and that's online already. So folks today can sign up through Ready Harris for testing through the 4 sites we have in Harris County already, through the 2 sites with Walgreens as well. And as you guys know, we also have the link on Ready Harris for all of the different government-sponsored testing sites around our region. So you can find there the link for the City of Houston sites, Fort Bend, Montgomery, Galveston, etc. The impressive and exciting thing about these 2 sites that Walgreens is providing is that these are 15-minute tests. These are rapid tests. Folks will not receive the results for 24 hours because they're state and federal reporting requirements, but that's fast. That's the kind of speed we need. So folks can get into that already for Friday. Of course, that's limited, so you can try the other options as well, and it will be based on symptoms and the CDC criteria. This is a perfect example of government and the private sector working together, and I want to thank Walgreens, of course, and Governor Abbott for his partnership and his leadership on this. Testing, quick testing, accessible testing is absolutely necessary to get to where we are. And of course, a thank you always to our healthcare workers, to our public health officials, and everyone on the front lines of this fight. So we will continue to work to make this available. We hope and trust that private sector supply chains will catch up as the days go by so we can have more and more testing for our region. This week, we were able to successfully launch the 2 additional county sites. So we had 2, one in Baytown, one in Katy, and now we've established 2 more sites which are pop-up. So they're in Tomball and the southeast part of town for 2 days, and then starting tomorrow they will be moving to precincts 1 and 3 in other parts of town, and that will be happening based on need, and we're seeing full demand for those test sites because we know that mobility is a challenge in our region, and we're very, very spread out. So I'll just conclude by saying, remember, we're very much still in the thick of this, and we need everyone's help to continue getting through this crisis, because to the extent that we continue to stay home while we get the testing, while we hit that peak, the peak will come sooner. The hurt to our economy will be less, and we'll be able to lift the order sooner. So we continue to need folks' support to follow the order, to stay home, to bear with us for the sake of our economy, yes, but also for the sake of our parents and grandparents and law enforcement and everyone, our friends, our family members who continue to be sick, to be hospitalized, and whose lives we can save. I'll repeat my remarks in Spanish, and then we'll hear from the other speakers. Primero me gustaría recordarles a todos dónde estamos en cuanto a esta batalla contra el virus. En este momento tenemos más de 4,000 casos entre la ciudad de Houston y el condado Harris, ya más de 50 muertes y siguen incrementando el número de casos. Recordemos cuáles son las situaciones en este momento. Son muertes más que nada de personas mayores, nuestros abuelos, abuelas, las personas que tal vez ya no estarán con nosotros este año, el Día de Acción de Gracias, o en otras celebraciones en familia. Esto se trata de vida y muerte, y por eso tenemos que seguir luchando. Nos está yendo mejor que otras comunidades de similar tamaño, por eso nos están observando en el gobierno federal, el gobierno estatal, con mucha atención, con algo de preocupación, pero por ahora, buenas noticias, ya que gracias a nuestros sacrificios y los sacrificios tempranos hemos podido llegar a donde estamos. Pero no hemos salido del momento peligroso, del peligro más fuerte. Todavía no hemos llegado a ese pico en casos. Sé que muchos están sufriendo por parte emocional, de salud mental, pero más que nada económicamente. Sé que el dolor, el impacto económico es extremadamente serio y yo más que nadie quiero que podamos regresar a la vida normal, reactivar la economía y volver a las vidas y a la comunidad que todos conocemos. Pero para poder hacer eso tenemos que tomar dos pasos. El primer paso es llegar a ese pico. Todavía no hemos llegado, todavía estamos viendo más pacientes cada día en los hospitales públicos se ven ya casi full. El segundo paso es pruebas universales. Pruebas universales y rápidas son necesarias para que sepamos quién tiene el virus y quién no. Esa es la única manera de saber quién puede regresar al trabajo y la única manera de poder retomar con nuestra economía. Desde el principio he dicho que sin adecuada capacidad de pruebas no podemos salir adelante con esto. Y realmente el fundamento, el enfoque, la fundación de la estrategia para reanudar nuestra economía es esas pruebas. Entonces, por eso me enorgullece el anuncio del día de hoy. Durante la última semana o 10 días he estado trabajando muy de cerca con el gobernador Abbott y también con el presidente de Walgreens, Richard Ashworth, para expandir la capacidad de pruebas en nuestra región. Walgreens tiene pruebas en solo ciertos estados, Illinois, Luisiana, Arizona, Michigan y ahora aquí en Texas. En Texas tenemos pruebas de Walgreens solamente en el condado Harris. Estas dos sedes, dos centros que estamos anunciando el día de hoy. Me enorgullece anunciar dos sedes, una en la ciudad de Houston y una en la ciudad de Pasadena. Y hemos estado en contacto también con el alcalde de Houston y el alcalde Wagner de Pasadena en este tema. Empezando el viernes, estas dos sedes de Walgreens empezarán a ofrecer servicios de pruebas todos los días de 9 de la mañana a 5 de la tarde. El sistema será similar a lo que hemos hecho en el condado. Va a haber un cuestionario breve por internet que hay que llenar para calificar. Las prioridades serán aquellas personas con síntomas y los requerimientos que anuncia el CDC. Ya está el link en internet, en Ready Harris, entonces puede visitar Ready Harris y empezar a llenar ese cuestionario. Ahora, en Ready Harris también puede encontrar la información para las 4 sedes que ya tiene el condado, las 2 sedes de la ciudad, las otras sedes en los condados Fort Bend, Montgomery, Galveston, todo eso lo tenemos en Ready Harris para que usted tenga acceso a las pruebas que son ofrecidas a nivel gobierno. Lo otro que es único y muy buenas noticias de estas sedes de Walgreens es que son pruebas rápidas. Estarán utilizando un sistema de pruebas de 15 minutos. Los resultados los recibirán los pacientes dentro de 24 horas, lo cual es increíble. El retraso es porque hay requerimientos de reportaje a los estados, a nivel estatal y nivel federal, pero dentro de 24 horas es adecuado y es hacia donde debemos ir para realmente salir de esto. No podemos luchar este virus solos y este es un ejemplo perfecto del trabajo entre el gobierno y el sector privado. Entonces le quiero agradecer a Walgreens y agradecerle al gobernador Abbott quien nos ha ayudado a llevar a cabo esto. No es suficiente para estar a donde debemos llegar, pero es un paso más que tomamos y cada día surgen más y más oportunidades como estas para que el sector privado también nos ayude en lograr que haya pruebas universalmente. Entonces, por ahora, seguimos con el mismo esfuerzo que hemos estado pidiendo a todos ustedes. Tenemos más pruebas, muy buenas noticias. Las 2 sedes del condado nos ha ido bien, ahora abrimos 2 sedes más, una ha estado en Baytown, la otra en Katy, el día de mañana. Disculpen, 2 sedes más, una de ellas estaba en Tomball y la otra en el sureste del condado. Y ya empezando mañana, esas 2 sedes adicionales se irán a mover, estarán en el precinto 1 y en el precinto 3. Entonces, estamos viendo a la comunidad utilizar estas nuevas sedes móviles y las estamos moviendo a donde vemos más necesidad, porque sabemos que este condado es muy grande, muchas personas no tienen carro, no es accesible. Entonces, seguiremos trabajando en eso. Ahora tenemos estas 2 más, ya 6 en el condado que nos ayudan adicionalmente a las de la ciudad y algunas más que tienen los laboratorios y los hospitales privados. Entonces, poco a poco vamos llegando a donde debemos estar. Todavía no hemos logrado ese tope, ese pico de casos, y por mientras les continúo a pedir que se queden en casa, que nos ayuden a continuar con esa responsabilidad, porque están salvando vidas de sus familiares, de sus abuelos, de sus amigos, de tantas personas que están hospitalizadas y que han muerto. Finalmente, quiero anunciar, he recibido ahora la nueva información de los casos en el condado Harris. Desde ayer hemos recibido 84 casos más y hasta las 11:15 de esta mañana me entristece anunciar 2 más muertes, 2 personas más que han perdido sus vidas, que no estarán con nosotros ya de ahora en adelante. Entonces, con eso concluyo y vamos ahorita a escuchar del comisionado García, el representante Armstrong de Walgreens, y luego recibiremos preguntas. Very briefly, before I head back to, before I pass this on to Commissioner Garcia and then to Roy Armstrong with Walgreens, I want to announce today's case count. As of 11:15 a.m., we have 84 new cases in Harris County outside of the city of Houston, and 2 new deaths, 2 people whose lives are now cut short by this invisible enemy that is coronavirus. So with that, I'll conclude. We'll hear from Commissioner Garcia in whose precincts these sites will be and who's been a fantastic partner and leader throughout this crisis, and then from Mr. Armstrong with Walgreens. Commissioner.
Thank you, Judge. Want to commend you for your beacon leadership. These are very difficult and dark times, but you're providing us with light and a direction for us to follow and for us to return to normal as quickly as possible. I, too, want to thank the state for working to provide this rapid testing process with the partnership of Walgreens. I will say that I already do a little bit of shopping at Walgreens. I'll probably be doing more, and I'm very grateful. And I'm hopeful that others like Walgreens will catch on and work to follow in their example. We need more testing. We need to provide people the opportunity who have concerns, but also primarily where they have someone at home who is in that high-risk category and that they want to make sure that they're not bringing something into their environment that they don't need to do so. So I'm very, very grateful for this. In particular, I also want to commend the city of Pasadena, council members Casado, Wheeler, Ibarra, Harrison, Mayor Wagner, because those council members have been steadily in my ear asking for more testing for their constituents, for the citizens of Pasadena, and this is a phenomenal opportunity. In this quadrant, if you will, the city of Pasadena, the city of LaPorte, the city of Baytown represent amongst the highest identified cases in the Precinct 2 community. And so I know that this testing site through Walgreens will be greatly, greatly appreciated and highly welcomed. Primeramente, gracias, jueza, por tu liderazgo. Gracias por el apoyo y ayudando a trabajar para darnos toda la comunidad una visión y una dirección para seguir y para salir de este pandémico lo más pronto posible. Así que gracias por el liderazgo que nos has dado durante esta crisis en particular. Y también le quiero dar las gracias al Estado de Texas por su trabajo en trabajar con Walgreens. Acabo de mencionar que yo ya compro algunas cosas en Walgreens, pero ahora yo creo que voy a comprar más y espero que otras empresas como Walgreens lleguen a trabajar para arrimarse y ofrecer los mismos servicios que Walgreens está ofreciendo. En el área de Pasadena, uno de los sitios está en Pasadena, y esto es muy importante allí porque los concejales Casado, Wheeler, Ibarra, Harrison y el alcalde Wagner han sido personas que realmente han llamado y suplicado para más pruebas en esta área. Entonces, yo sé que estas buenas noticias para ellos y para la gente de Pasadena. Y también hay que reconocer que la ciudad de LaPorte, la ciudad de Baytown y la ciudad de Pasadena llegan a representar dentro de los municipales los casos más altos en el precinto 2. Entonces, esto es algo que me ha preocupado y por eso estoy muy, muy emocionado que ya tenemos enlace con el Estado y con Walgreens, aquí con el condado Harris y la ciudad de Pasadena. I just want to close once again to offer my compliments and my appreciation to the company of Walgreens. Thank you for your leadership. I know that this is a difficult task to undertake, but I appreciate your willingness to help out the citizens of Harris County and the city of Pasadena. Gracias. Thank you.
Good morning. So as you already heard, that Walgreens is very pleased to be a partner to help manage this pandemic and get it under control going forward. Walgreens is a big part of the community here for 80 plus years, and we welcome the opportunity to do our part to be on the front line of this healthcare crisis. So as the county judge already mentioned, we'll be opening 2 testing sites tomorrow in Harris County. So we will be doing the rapid tests that you already heard about. So the opportunity here around testing is to get results quicker. So obviously there's a big need to expand testing. So we are so glad to add 2 additional sites to the 4 sites you already have throughout Harris County. So at these locations, Walgreens pharmacists will oversee individuals as they self-administer the test. So the test we are using is the new Abbott ID Now test. So this test is less invasive than most tests out there and certainly provides quicker results. So both locations we have are already taking appointments as of today. So individuals just need to go to walgreens.com/coronavirus to fill out a questionnaire based on CDC guidelines to establish an appointment starting tomorrow. So the 2 locations we have, the one in Houston is located at 14531 Westheimer at the intersection of Westheimer and Highway 6, and the location in Pasadena is located at 101 West Southmore at the location of Southmore and Shaver. So once again, the testing will be available starting tomorrow at no cost to individuals. Thank you.
Thank you so much, Mr. Armstrong. And just to reiterate, as with our sites, we ask that folks not show up without having done the online screening, because you will only be allowed with the pass, the number that folks will get once they've completed the screening. We'll open it up for questions now.
Hi guys, I'm sort of operating as at least the English part of the pool reports, and I just wanted to know, can you, the gentleman from Walgreens, can you describe more specifically what we're talking about? The 15-minute test, this is not the antibody test, it's the live virus test. And also there was some talk about first responders getting initial access to that. Can you just tell us specifically what kind of test? Give us a little more detail.
Mr. Armstrong, yeah.
Absolutely. So yes, we are making tests available for first responders, healthcare workers, and those 65 and older that are showing symptoms. So priority 1 and priority 2 patients.
So do they, go ahead, I'm sorry.
What's the question?
Well, do they have are they also, if you're like a firefighter or police officer, do you already have, or a medical worker, do you already have some of those people lined up, or do they need to go on the website as well?
They should go on the website as well. So, and once again, the test is the rapid test. It's the new ID Now test by Abbott Laboratories that gives you results in 15 minutes. So, as the county judge commented, we will be providing those results within 24 hours.
So that's that's the live virus test, right? Because don't you guys have 2 rapid tests that are coming onto the market, both the live virus and the antibody? And I think in the public there's some confusion
Yes.
about what exactly you are. So could you specifically tell us that?
Yeah, this is the live virus test. So we basically letting folks know if they're positive or negative for the virus.
And you're only doing it 2 sites. Are there plans to expand that as availability for other at other Walgreens, maybe as a cash base or insurance pay basis?
I would expect that we would expand at some point. There's limited resources right now, so I think that limits the number of sites we can have right now. So I would expect that would expand with the significant need for testing around Harris County right now.
And you anticipate having these supplies for a while, like 2 months? Or, how long will you stand up the sites for?
I would expect that we would be in place as long as there's a need.
Okay. Judge, I'm sorry, you wanted to add to that.
Yeah, just, the screening tool in the CDC also asks if folks are first responders, and so that's part of the, the criteria, as I know. But we do need everybody to go through that screening tool. And again, as we get more testing, we hope to be able to open to, asymptomatic, to other groups. Right now, we've got to prioritize folks with symptoms.
So you don't want Harris County, whether it's with the county testing sites, the pop-up sites, or the Walgreens, you don't want the average concerned citizen to call. You still want only symptomatic, elderly.
Look, if you have symptoms and you feel you need a test, go online, go to Ready Harris, fill out the form. I can tell you both systems will be prioritizing and are requiring symptoms. And so, and they're following the CDC guidelines. Now, we're continually evaluating if we get to the point where we have the capacity to test everybody with symptoms, then we would move on to asymptomatic, and we'll make the announcement once we get there, but we're not there right now.
Do you have data of how many people got tested in your 4 sites yesterday?
I don't have it right now. What we know is we have a lot of demand, overwhelming demand for the mobile sites, we have enough demand to cover all sites. The issue is redistributing it across sites. So we're trying to work with FEMA so that they can allow us to use perhaps some of the resources from the first 2 sites in the mobile sites, or how we can make sure that we're distributing that need evenly. But right now we have more need than there are tests. Now we'll continue to watch that, and as soon as it changes, we'll reevaluate.
And I think the city's facing the same issue, is that you have the capacity, increased capacity, and you have the need, of course, but there seems to be a gap because people have to call or use the internet there's a gap of not actually administering the full lot you have available, because people either don't show because of after making an appointment they can't get transportation there or something. So for example, the city of Houston gave me the numbers, and they only did like 500 some odd tests yesterday, even though they have 1,000 available, and you guys have 1,200 available. And I anticipate the numbers are not going to show that you did 1,200 tests. So how do you bridge that gap of making sure you use every bit?
Yeah, so historically we've used all of it. I mean, sometimes you assign, when we had 500, you assign 500, and at the last minute, you end up with 490, 10 people didn't show up, and so you can't control for that slight shift. Now, we did open it up before yesterday. to an additional 200 people. That was full. So then we opened the full lot, and what we're seeing, and I got this from Public Health this morning, is that we are having, as I said, many more people who need the mobile sites than the other ones. And so how can we redistribute resources or somehow facilitate that? We knew that was a need. We knew the geography is a problem. That's why as soon as we got more resources, we established these sites that we can move around. We believe that the Walgreens test will also alleviate that. So it's just putting the puzzle pieces together. And the issue is that the materials, the 2 mobile sites we've procured independently. Harris County has procured independently through a vendor. The 2 static sites are, we receive resources from the federal government, and they require us so far to use them only for those sites. So even if we have more people sign up and they need to do it elsewhere, they can't make it to the first 2 sites, we still, we can't reassign them elsewhere. And so we're working on that. As I said, we don't want there to be a gap, and so we'll be watching today and tomorrow. And if that continues to be an issue, we may have to open it up to a wider array of folks. But as of the latest data, we know that there are more people with symptoms than there are tests. So we don't want to put folks in front of those people with symptoms until we know that we've done everything we possibly can to pair the symptomatic folks with the sites.
Right, because on Tuesday it was like you guys only tested like 580 people out of 1,000. But anyway, I'll move on. From KPRC, they said two questions. One is, if you as the county judge were to open up the county's economy, what would you open up first? Have you guys thought about that?
Yes, we're in conversations right now about what we'd open up. Of course, looking at the guidance that the governor will be working on, that the federal government is working on. We are continuing to work with our academics on this, looking at other countries. It's too soon to say for me exactly what would come first and what later. I think, the focus right now is first, yes, we're working on that. Most importantly, we are not there yet. Number 1, we need to hit the peak. We haven't hit it. Number 2, we need to have universal accessible testing. We have more testing. In 1 week, we went from 2 sites to 6 sites. We still have some hiccups there on, making sure we're pairing folks with the supply with demand, but we know we need more testing even beyond that. And so I'm hoping and I trust that as those 2 work streams come forward, more testing like the kind we announced today, and also we level off that curve, then we'll be ready to move on. But all models and projections show us that won't be for at least another couple weeks. And remember, if folks begin to go out and about and disregard the order, that will only take longer. It will only take longer for the peak to arrive. So those conversations about what we would open are important. They're necessary. We're having them. But I want to caution against folks thinking because we're having a conversation, that means that we're ready to open. We are not.
Okay, can you describe, KPRC would like to know how much planning you're doing related to the anticipated opening, whenever that is?
The biggest planning right now goes to the testing. It goes to the capacity, the modeling. You got to remember, we're going to have the main peak, and we'll hit that peak. And then eventually, once we reopen, we'll have another one, and we'll probably have more. And so before we reopen, we've got to have that. We've got to have clear projections also of where we're going and how we'd react. So all of this goes around reopening is frankly easier questions than saying, we'll start with this, we'll start with that. The point is, the minute you reopen, whether, obviously we'd probably hold back on bigger size gatherings, we'll be making those kinds of decisions and we're discussing it, but that's the easy part. The hard part is, okay, whatever you open, you're going to see cases again. Then what do you do? And so if we don't have the testing ready, what will we do? We'll have to shut everything back down. So we can't do this prematurely. It doesn't serve the economy. We would just end up back where we started. So we're working round the clock to get to where we need to be. Some of it is out of our hands in terms of, supply chains, but you can see we're pushing. You know, we managed to get these 2 additional sites. We've managed to secure this with the partnership of the governor and Walgreens, and we're continuing to ask for more support.
A question from KRIV about other cities and states are addressing the needs of undocumented immigrants with their own stimulus checks. Is there something that is being considered in Harris County? Why or why not?
Yes, we're working for all communities in Harris County. Folks know we are, 25% immigrant. We're incredibly diverse, one of the most diverse, if not the most diverse county, and we do have a large undocumented population. The sites, the testing is available to everybody. We're not asking, immigration status. Obviously, our mental health line is open. The child care services, folks who have children who are U.S. citizens, and if they themselves are essential workers, they're also being paired with the services and with the aid. We have established a recovery fund with the United Way and the Greater Houston Community Foundation. Mayor Turner and I are both endorsing that fund, and the fund it has already raised several millions of dollars, and those dollars go directly to assistance to individual families, including families who are undocumented. The county issued, and Commissioner Garcia led this effort, a $10 million 0% interest loan program, forgivable loan program for small businesses. We are currently working on round 2 of that, or support for individuals, rental assistance, that kind of thing. We want to make sure we're not duplicating what the relief fund is already doing. So the answer is yes, that's many of the ways in which we're doing this. And we want to look out for all communities, because this virus will come after everybody.
Judge, one more question in English. They want to clarify if HFD and HPD are getting tested at either of the Walgreens locations today. If not, when will that begin?
Right now, today the Walgreens locations are not open. They're opening tomorrow. I do know that the questionnaire includes whether they're first responders. Obviously, Walgreens is manning and leading how they prioritize that, but I do know that first responders with symptoms will be a priority, and so we do ask first responders to help us fill that out.
Okay. I have questions in Spanish now. First one from Telemundo. Ya son más de 135,000 las pérdidas. Hold on, I'm lost. Ya son más de 135,000 las personas que perdieron su trabajo solo en el condado de Harris. ¿Qué están haciendo para ayudar a toda esa gente que le falta empleado?
Sí, sé que son muchas las personas que han perdido el trabajo y el impacto es para toda la comunidad. Hemos hecho varias cosas en el condado. Primero, el trabajo que hemos hecho en cuanto a desalojos con los jueces. Se ha extendido esa orden, yo sé ya por parte de los jueces que no habrá desalojos al menos hasta el próximo mes. También se ha establecido un fondo. 2 fundaciones, el alcalde y yo, hemos endosado y trabajado con ellos en establecer un fondo que ya ha repartido o recolectado millones de dólares para familias que han perdido trabajos individuales, apoyarlos con fondos para renta, comida, necesidades básicas. Nuestras pruebas, todas nuestras sedes son accesibles a todas personas. No es necesario tener seguro médico ni tampoco evidencia de ser ciudadanos americanos. El condado ha otorgado $10 millones en préstamos de 0 interés, préstamos que pueden no tener que ser pagados a pequeñas empresas, negocios pequeños. Ya se ha procesado esas empresas que han aplicado y estamos investigando la posibilidad de establecer más fondos aún del condado para pequeñas empresas o para individuos. Ahora, yo sé que eso no va a solucionar el problema económico. La economía está en una situación muy difícil por parte mundial, por parte nacional, estatal. el condado, con los fondos que tenemos nosotros como localidad, no podemos rescatar la economía completa, pero estamos haciendo todo lo posible con estos pasos que hemos tomado. Y aunque es muy difícil tener que estar en casa, perder estos trabajos, ya el haber hecho eso ha salvado más de 4.500 vidas, de acuerdo a la Universidad de Rice. Además, esto nos ha ayudado a que la curva termine más pronto. Si empezamos a salir, más se va a extender esto y más tiempo se va a ver la economía afectada.
¿Hay algo de preocupación que ahora el condado Harris es el que más desempleo se está reportando en Texas?
Es preocupante que reportemos cualquier desempleo, es realmente difícil. Obviamente somos el condado más grande de Texas, entonces es natural que tengamos más desempleos que cualquier otro condado, tenemos mucha más gente. Recuerden que el condado tiene al menos 5 millones de personas, somos más grande que el estado de Luisiana, el estado de Colorado y más de 26 estados. Entonces, es grave, es una situación muy grave. A nivel mundial no se sabe qué va a suceder realmente con la economía, cómo nos vamos a recuperar, pero estamos trabajando todos juntos nosotros, las entidades privadas, las organizaciones sin ánimo de lucro, para trabajar y apoyar estos negocios como ya lo hemos hecho y lo seguiremos haciendo. Por ahora la prioridad es que pase esta crisis lo más pronto posible para que podamos regresar a la vida normal. Y para hacer eso tenemos que seguir quedándonos en casa hasta que lleguemos a ese pico, todavía no hemos llegado, y también darle chance a que se desarrollen más pruebas, porque si abrimos antes de que hayan pruebas, simplemente vamos a tener que volver a cerrar. Yo entiendo la ansiedad, la necesidad de decir, tenemos que reabrir ya, pero aunque lo hiciéramos, volverían a surgir los casos, no tenemos suficientes pruebas y tendríamos que volver a cerrar, entonces quedaríamos donde estábamos hace 3 semanas y esto duraría todavía más. Entonces, sepan que para mí esto es una prioridad, poder reabrir cuando sea posible, cuando tengamos esas dos cosas. El comisionado García ha trabajado en esto, la senadora Alvarado, la congresista García, todos los representantes estamos trabajando en esto.
Dijo un poquito adelante que había hablado con Greg Abbott, pero el presidente Donald Trump tiene previsto anunciar hoy el plan de reactivar la economía. Y el gobernador de Texas, Greg Abbott, estará anunciando su plan del día de mañana. ¿Ha discutido estos temas con ellos y qué está haciendo el condado de Harris ante reabrir los negocios?
Sí, he conversado bastante con el gobernador Abbott, todos estamos discutiendo cómo se podría reabrir la economía y está bien tener esas conversaciones, pero quiero dejar muy claro que el discutir cómo se reabriría la economía no significa que estamos listos para reabrir la economía. En este momento no lo estamos. Sí que estamos teniendo las conversaciones y sabemos que probablemente no abriríamos reuniones grandes, festivales, donde sea mucha gente. Tendríamos que tener un nivel de priorización. Pero eso es la parte fácil, decidir qué se abre y qué no se abre. Lo difícil es estar listos para poder abrir de una manera responsable. Para llegar ahí necesitamos tomar 2 pasos. Primero tenemos que llegar al pico de la curva, no hemos llegado. Y segundo, tenemos que tener suficientes pruebas para saber quién tiene el virus y poder aislar a esas personas y que los demás puedan seguir trabajando. No tenemos todavía suficientes pruebas para eso. Entonces, estamos en proceso, estamos llevando ambas cosas y esperemos que ambos caminos, tanto sea el pico de la curva hasta las pruebas, que podamos lograr ambas cosas al mismo tiempo y se pueda reanudar la actividad lo más pronto posible. Estamos trabajando día y noche por tener más pruebas, como hemos hecho el día de hoy, y los casos, entre más la gente nos ayuda a quedarse en casa, más rápidamente vamos a llegar a ese pico, a ese tope. Si empezamos a salir, se va a extender más el virus y vamos a seguir viendo un crecimiento en el número de casos y se nos va a ir la vida esperando a que llegue el tope. Entonces, por favor, ayúdenos, quédese en casa. Entre más hagamos eso, más pronto posible vamos a poder retomar las actividades.
Menciona regresar en una manera adecuada. Ahora hablamos, cuando empiecen a abrir los negocios, ¿se imagina cómo vayan a operar las compañías?
Espero que las compañías y todos vamos a tener que tomar medidas nuevas, tal vez utilizar todos máscaras, definitivamente continuar con el distanciamiento social aun cuando estemos trabajando. Vamos a tener que tomar medidas necesarias y probablemente por un futuro bastante largo, unos meses, tal vez aún más, porque va a seguir el virus en la comunidad. Pero reitero, Eso es un tema importante a discutir, pero no quiero dar la idea de que porque lo estamos discutiendo significa que ya se va a reanudar. No podemos reanudar ni retomar las actividades hasta que no tengamos suficientes pruebas y hasta que no hemos llegado al tope de los casos, y todavía no estamos allí.
Últimas dos en español por Univisión. ¿Cuál es la razón por cual decidieron abrir estos centros en estas locaciones? ¿Es debido al número de contactos en esa zona?
Decidimos abrir las sedes, los centros de pruebas en las locaciones necesarias, dado los códigos postales de personas que han dicho necesitan una prueba. Como saben, tenemos un sistema de un cuestionario por internet en Ready Harris que las personas deben llenar antes de poder acceder a las pruebas. Y hemos visto que hay bastantes personas en esas áreas de la ciudad que requieren pruebas, particularmente en el este. Le dijimos a Walgreens, por favor, ayúdenos a encontrar un centro en la parte este, y nos pudieron dar este espacio en Pasadena. Y bueno, era necesario tener un centro en la ciudad de Houston, dado la cantidad de los casos. Los dos centros móviles que tenemos los hemos puesto primero en Tomball y en el sureste del condado, pero se estará moviendo mañana y se seguirán moviendo semanalmente dependiendo a la necesidad que vean, no tanto de casos ya reportados, sino de personas con síntomas que están buscando pruebas.
¿Cuál es el número para hablar para que te den el número de identificación personal para hacerte la prueba?
Para hacerse la prueba, para recibir el número de identificación personal, para hacerse la prueba, por favor, visite readyharris.org, allí está el cuestionario. Si no tienen internet, allí está el número, lo compartiremos con la prensa después, y también hay un número que pueden llamar directamente, pero la información en este momento y el número de teléfono está en Ready Harris. Toda la información, tanto en línea como por teléfono, está disponible en español. Y no se le hacen preguntas acerca de su estatus migratorio.
¿Cuál es la asistencia para la gente pacientes del coronavirus que no tienen?
The Harris County Judge and Walgreens announcing a partnership this morning that will provide rapid COVID testing at 2 different sites in Harris County, up to 400 tests each day. This will start tomorrow, although they're taking appointments today. This is only for people with symptoms, but one of those sites will be out in Walgreens in Pasadena at Southmore and Shaver. The other one will be on Westheimer at Highway 6. If you try to Google that location, you won't find it because it's a closed Walgreens, but they're going to reopen for this testing starting tomorrow. So 200 tests per day per site. People with symptoms can get it. You have to get online and take that questionnaire first. ReadyHarris.org is the place to do that. But again, this is rapid testing, a live virus test. This will tell you if you have the coronavirus in your system. They will have the results quickly. You will get the results within 24 hours. So that is good news that it's happening that quickly. Walgreens saying they hope to expand this at some point. They just don't have the test kits right now to be able to do that. But Walgreens is only doing this in 2 places in the state of Texas, and both of them are in Harris County. So that is something that can happen starting tomorrow. But again, they're taking appointments starting today.